In this talk, I'm going to cover how to take a history for the PLAB-2 exam to maximise your chances of success. The basic structure of a history-taking station comprises of three sections. Firstly, data gathering. Secondly, communication skills. And thirdly, management. The traditional approach to taking a history involves a linear structure in which the physician asks a series of interview-style questions to the patient to maximise the data gathering opportunity. However, this is not what's recommended in the PLAB-2. Whereas with the traditional approach, a physician might first start by asking about the presenting complaint, then the history of the presenting complaint, past medical history, drug history, allergies, and so on, we're going to recommend you instead adapt your history taking somewhat to use the Calgary-Cambridge approach. And I'm going to talk you through what that involves right now. The Calgary-Cambridge approach is a more modern, structured way to approach the history taking interview that puts the patient at the centre of the consultation and puts the doctor in the position of a sort of guide, helping the patients through the consultation to maximise the encounter to mutual benefit. There are four main sections to the Calgary-Cambridge approach. Firstly, initiating the session. Secondly, gathering information. Thirdly, explanation and planning. And finally, closing the interview. Let's talk through each of those sections right now. Firstly, initiating the session. You should always begin in PLAB-2 by introducing yourself and stating your role. But as soon as you've done this, you should start with an open question to the patient, such as, why have you come to talk to me today? Or what brought you in? Or what would you like to discuss today? You should then allow the patient plenty of time to report everything they want to do and engage in active listening so that you can understand and carefully internalise everything that they're telling you. Even the most talkative patient will finish in under a minute, which is plenty of time for you to cover the remaining parts of the station. After the patient has finished talking about their presenting problem, you should move on to the stage of the interview where you gather information. At this point, you need to adapt your questions according to the reason the patient has come. For example, if the patient is talking about pain, you could ask for more information using the Socrates approach. That stands for site, onset, character, radiation, association, time course, exacerbating factors, and relieving factors. Depending on what the patient has come with, there may be a number of different approaches or questions to ask next, but it's your job to ask the most pertinent ones relevant to what the patient's presenting complaint is. A critical difference in the Calgary-Cambridge approach, while you're gathering information, you should also take time to understand the patient's ideas, concerns, and expectations, or ICE, as we call them. This is crucial for the PLAB-2 exam and crucial in ensuring that you address your patient's concerns and worries appropriately. The third section in the Calgary-Cambridge approach is explanation and planning. During this, you should first ensure that you completely understand where the patient's starting point is, what they understand about why they've come, and what they're hoping for in terms of how you can help them. Your goal here is to form a shared understanding of the patient's problems and also the management plan that you're proposing. For example, what investigations you want to arrange and what treatments you're going to propose there and then. Finally, you should summarize with the patient and go through all the most critical pieces of information that you've discussed to help your patient understand and recall everything that you've covered. By using elements of the traditional method of taking a history alongside the Calgary-Cambridge method, your chances of passing the PLAB-2 exam are maximised and you have the very best chance of success. The examiners want to see you and cover the patient's ideas, concerns and expectations, and it's important to adapt your approach in this exam such that you can do this. Very best of luck.